Welcome to the International Journal of Paramedicine podcast. I'm Eoin Walker and delighted today to have the authors of a paper we're going to study in depth today, Bram Duffee and Andy Newton, here to talk about a manuscript. Before we crack on with the episode, welcome both to the podcast.
Oh, thank you so much for inviting me.
Wonderful to be here. Great to see you again, Ian.
So we're just going to start off by just really examining the article itself. So it's entitled From Harm to Healing, Addressing the Nocebic Effects of Negative Language in Emergency Care. Before we get into the interview, I just want to let you know that many of the manuscripts published in IJOP marks the start of a discussion on that topic within the paramedicine community on the NESMA email listserv, which is hosted on Google Groups at groups.google.com/g/NESMA/. So NESMA is NEMSMA. So after you've watched or listened to this podcast, do read the manuscript and then go to the NESMA listserv to ask questions and indeed make comments about this or other papers. We really want to get your and others' feedback really and start to engage the community of paramedicine into scholarly discourse from really the advancement of our discipline. So the NESMA email discussion group is moderated listserv, so please be courteous, professional, and please don't post anonymously, and let everyone know who you are. So you should also know that our editorial team will curate the best parts of the email discussion threads for inclusion in dialogue section in the journal, which is our version of the traditional letters to the editor section. So if your question or indeed comment is selected for the dialogues, you'll be officially cited. So please join and access the NESMA discussion group at https://groups.google.com/g/NESMA. So it really is about making your voice heard in the paramedicine professional community. So let's crack on with the interview. So let's just get started. And Bram, I'll come to you first. If you could just start by telling us a bit of your background.
Yeah, so I'm an assistant professor of communication at Kennesaw State University. So I teach in Georgia, and then I live in Houston, Texas, where I work as a full-time paramedic. And I'm also the director of graduate research for the First Responder Behavioral Health Institute.
Listen, that's fantastic. Absolutely fantastic. And we have Andy Newton with us as well. Andy, could I just get you to speak to your background?
Certainly. So my background is very much National Health Service, consultant paramedic, a director within the NHS. And when I took early retirement, I then went to move into medico-legal work, which is where I sit at the moment along with consultancy. Also a past chair of the College of Paramedics and currently a trustee of the British Society of Clinical and Academic Hypnosis.
Fantastic. Absolutely fantastic. So Bram, I'm just going to come to you. Just if you could just really unpack the problem and or issue that you were really trying to solve and address with this project.
So I've been working with this issue and stuff for a long time. I'm the co-author of Hypnotic Communication in Emergency Medical Settings. And that's a book that came out 2 years ago that really exploded on this issue. And we continued with this, and I got connected with Andy. And Andy and I wanted to look at how the words that paramedics use can affect patients during emergencies. Because sometimes, without meaning to, paramedics might say things in a way that makes patients feel more scared or in more pain. And this can make a tough situation even harder on the patient. And so our goal was to show how using positive and calming language can help patients feel less anxious, trust their paramedic more, and even maybe recover better.
Yeah, I think it's particularly pertinent, like you said, in an emergency setting when actually what you want to do is actually soothe and indeed reassure the patient, not expedite any of their symptoms. Andy, from your perspective as indeed a co-author and really supporting Bram, is there anything you'd like to add to that?
Well, I think Bram's covered it pretty clearly, but I would say the problem is probably bigger rather than a the peripheral issue that some people would sort of consider it. And that's because pretty much in every clinical setting, language is of huge importance and yet massively underestimated. People don't think about the use of language in the way we think about prescribing or utilizing a medication, but we'd like people to consider them to be of similar gravity.
So let's just look at really how you approach the problem in this project. And Bram, could I just get you to speak to really how you sort of started to parse apart the research and indeed unpick the title even and really start
Yeah.
to approach this research?
So we noticed that while there's a lot of research out there about how doctors and nurses talk to patients, there just wasn't much about paramedics. And these are folks who often deal with very stressful, very scary moments. And we also learned that during emergencies, patients are in kind of a heightened state. And this is where they're extra sensitive to what's being said around them. And this means that the words paramedics use can have a big impact, either making things worse or helping patients feel calmer. And so we wanted to explore how paramedics could use this knowledge to make their care even better.
Absolutely, absolutely. And so just to speak to that a little bit deeper, actually, Bram, could I get you to really unpack the methods and indeed the methodology you employed for the project?
So what we were doing was looking at nocebic communication, and to do that, we developed a literature review of different being able to unpack all that's been explored so far on this topic. Because as humans, we know what it feels like to have someone talk nice to us versus what it feels like to have someone, speak harshly to us. And when we're extra sensitive in these moments, the feeling is real. And so what we did was work to unpack even from a biological level, all through a psychological level, how this can play out.
Yeah, absolutely, absolutely. And Andy, just, as Bram was saying, passing apart, understanding the current literature base, understanding the dearth or lack of literature in paramedicine. Could I get you to speak to really what became apparent within sort of the neurophysiological effects of nocebic language, and indeed how that can transform the care received in pre-hospital care?
Sure. Well, a couple of things here. So firstly, we're going beyond what would normally be considered clinical communication or just pure civility or professional communication. That's almost a given, although we accept it often isn't. So now we're talking about the use of words, sentence structures, syntax that can have a demonstrable modifying effect on neurophysiology. So this gives one the opportunity as a clinician to modify the patient's perception of pain and anxiety. So these are really very well studied and measurable effects, certainly in the non-pre-hospital setting. So we're really just extrapolating that evidence base into the pre-hospital world and making the sort of we think, very strong suggestion that paramedics need to be far more conscious of just how they speak to patients, how they structure their language. And this is because, as Bram's alluded to very, very clearly there, patients who are in an acute phase of trauma or traumatic injury or perhaps acute illness, they do become more susceptible. It's almost akin to a trance equivalent state, and it probably has an evolutionary basis. It essentially means more people are more impressionable, and it essentially means that people will process what's being said at a subconscious level and react accordingly, potentially negatively interpreting what you're saying.
Yeah, indeed, indeed. And I'll get Bram to speak to the findings actually, because as you were saying, this hyper suggestibility in emergencies, where, like you said, fundamentally they are led by the clinician. Therefore, there's this fundamental bridge of trust, but then there's with extreme trust comes extreme responsibility to guide treatment modalities for the interest of the patient. But there's also, and I'll get Bram again to speak to this, around what the paper suggested about sort of stress response modulation and hypothalamic pituitary adrenal axis extreme activity, the amygdala firing, and the response there. So there's almost an adrenergic and a hormonal response. There's a neurophysiological response. There's, as you were saying, Andy, almost a hypnotic response. Bram, I guess in a way, could I get you to speak to just the wide gamut of findings that you uncovered from your research?
Yeah, it is really extremely interesting because as a paramedic, we are in these situations where we see folks in these hypnotic states, in these sort of mental superpositional states, and it's really a time that I now see as special and I'm very super sensitive with the things that I say. I want to go on a limb and say that there are paramedics who don't even care about the words that come out of their mouth because the only focus is on the actions, right? Like maybe they need the IV quickly, maybe they need the oxygen quickly. But we found that the way paramedics talk to patients can make a big difference. So if they use negative or scary words, it can make patients feel more anxious and in more pain. But if they use calm and more positive words, it can help patients feel safer and more comfortable. So like if you're going to say, this is going to hurt, that automatically implies that pain is coming. And so we want to do everything that we can to help you feel comfortable, and so as a patient. And so one of the fun pet peeves that I've developed after writing about this and studying this is I think a lot of folks, when they put the patient into the back of the ambulance, they let them know, you're going to feel some bumps, you're going to feel, some let them know that something not so good is getting ready to happen to them. And so instead of saying something that could be perceived as negative to the patient in that moment, I have developed in my repertoire that I normally say, we're going to lock this bed into the ambulance now, and I'm going to be with you. It's just the time that I say that. And I look back at all the times before when I said, there's just going to be some bumps now, and gosh, that's scary alone. But on top of it, this is a super sensitive patient, and all of those words matter, whether they're positive or negative.
Yeah, absolutely, absolutely, and to both of your points actually around the non-verbal cues, as important as the verbal ones, the intonation, the tonality, the cadence of communication. But Brown, to your point, overtly communicating so that there's no guessing game. Really unpack the next 5, 10, 15 minutes, but just so there really is a shared situation awareness towards the patient, which again starts to hopefully build rapport, but also calms physiology. And on the back of that, Andy, I'll come to you really just to speak to ethical communication, because the research in the piece really showcases a fantastic point around ethical communication practice. Could I get you to speak to that?
Yes, well, I think we could almost describe communication as a sort of patient safety issue. I think we'd sort of consider it certainly in those sort of terms, because poor patient communication, if one accepts that the CB effect inducing language is very real, and it is very real, then clearly inappropriate communication can lead to patient harm. It can lead to a poorer outcome. Some researchers feel it can actually lead to an increase in the incidence of PTSD. So there's a real onus on the paramedic, on the first responder, on the clinician to be very well informed and to utilize the correct forms of language to avoid those entirely unwanted negative effects. So it is an ethical issue as you describe. And some people would say, well, if this is sort of a hypnosis type situation, well, we can't have people going around hypnotizing people. But in fact, of course, our premise is that the very circumstances the patient find themselves in, whether it be acute trauma or acute illness, as referenced earlier, places them in a situation of this very receptive, very vulnerable condition. And so we have to safeguard them in the way we would safeguard patients in any other sort of situation or in any other circumstance. And we can do that by structuring our language in a way that modifies, as you acknowledged earlier, those processes that are occurring within the brain, particularly focused in the anterior cingulate cortex, and of course other whole sequences and cascades of events that follow on from that. And just having that sort of knowledge at your elbow really makes you a much more effective clinician. I can give you a couple of examples. Just recently, I do far less clinical work than Bram, but utilizing language, thoughtful language that is hypnoidal, can have very rapid and positive effects. As simple as applying oxygen or a nebulizer and getting the patient to mentally think about what's happening and structuring your language in a way that you're anticipating a positive outcome, and also trying to alleviate their stress, and of course going through the whole process of building rapport. And it really does work, and it works quickly.
Yeah, absolutely, absolutely. So just to really finish off, actually, Bram, I'll give you the final word, just to really get you to speak to what the study and indeed the findings suggest in the end. What was the fruition and indeed the recommendations from this study?
Well, to kind of reiterate also what Andy just said, the patients that we're encountering are already in this state of hypnosis. So it's not like we're doing anything to them. It's just behooving to us to know that there's a good way out there to respond. And we hope that this research will help paramedics see how powerful their words can be, because by learning to be more positive and calming language, we can make a big difference in how our patients feel during and after an emergency. And I know that we also think that this can help paramedics feel better about their work, and knowing that, heck, we're not just treating a physical injury, we're also helping patients feel emotionally supported. And in the long run, we'd love to see this kind of communication training become a regular part of paramedic education.
Absolutely. No, absolutely. So it's a fantastic piece. Do go away and read it within the journal. Please do join the conversation at groups.google.com/g/NESMA/. So get other IJOP videos added to your feed by subscribing to the IJOP channel on YouTube, or indeed your favorite audio podcast platform. So on behalf of National EMS Management Association and the entire journal staff, thank you for listening and watching. And indeed, thank you to Bram and Andy.